Hi, this is Dr. Christopher Maloney talking to you about vaccination. Now, people always ask me, where do you stand with this? I'd say, well, personally, I was vaccinated 4 times. My parents deny this, but I remember the 4th time I got vaccinated for polio and I fell down in the hall because I had such a dramatic immune response to it. Vaccination is a public health issue. That means that we make public health decisions about vaccinations. One of the public health decisions we've made is that hepatitis B vaccine is being given to all of our children. We made that decision because we were unable to get the IV drug users and the people who are having unprotected sex to come in and get vaccinated for hepatitis B. So now we're vaccinating everyone for that. We're vaccinating at birth, when basically the blood supply is fairly safe and you're not going to get hepatitis B at that point from transfusions, and let's be honest, most 1 and 2 year olds are not going out and using IV drugs or having unprotected sex at that point. So there's really an unnecessary focus on early vaccination because there's a portion of the population that you're not going to get back in. They're coming in to get their well baby checks, they're coming into the hospital, you get those people right off the bat, otherwise they're not going to come back in. We have between something in the 15 to 20% range of people, parents who are just not getting their kids vaccinated because they don't remember or their lives are too busy or whatever. It's about 5% of the population that even considers not vaccinating their children. I'm sorry, a herd immunity group is at 95%, or if you take out all the people who've forgotten or just haven't gotten around to vaccinating their children, you're talking about an 80% vaccination possible. Most herd immunity models are based on this. This is enough. We've had enough people vaccinated to stop the diseases from being spread. So that little group of 5% that are considering not vaccinating their kids are really not increasing the public health risk of anybody else. The problem is when you vaccinate all these other kids, the mass majority of them, there's going to be a proportion of those that are not going to actually respond to the vaccination. They're not going to generate antibodies, and they're going to be susceptible to those illnesses. The other piece is even if they do respond, those antibodies are not coming to the oral route, they're coming through the arm, and you're going to see a decrease or possible loss of those antibodies over a period of possibly 18 years. We use the MMR as an example. Measles, mumps, and rubella. When I was a child, I was vaccinated many times for measles, mumps, and rubella, and by the time I hit college, they were vaccinating me again for measles, mumps, and rubella, and I don't see that we're doing that again, because in Maine, in the last 12 years, the only outbreak of mumps we've had is among the college-age population among vaccinated children. And so there wasn't enough, there wasn't people. Now there was an outbreak out west where there were mostly unvaccinated children. These kids all got the mumps. And it made the paper, all these unvaccinated people, these are causing all these problems. And I'm like, they all got the disease, they got the mumps, and none of the rest of you did, so that's not a problem when they're not vaccinated. Among the vaccinated college students, that guy would be pissed off. I'd be saying, well, I got vaccinated, I did exactly what I was supposed to do, and I'm not protected, I still got the mumps. I was vaccinated when I was 18. If my antibodies initially only went till I was 18 and I got vaccinated at 18 and I'm 18 years older or more than I was then at this point I would expect that I am not actually proof against measles, mumps, and rubella. I need a booster shot, but no one's asking me to do that, no one's telling me I should do that, and I don't see the studies out there saying, hey, we're going to need to have everybody vaccinated every 18 years. It's just not, the data is not there. I will also say that I am the one who people come to, and I want to be really clear about this. I have a case of a kid coming in. He seemed to have gotten the chickenpox virus 4 times. The pediatrician said to him, no, it's not chickenpox. I said, it looks like chickenpox, it seems like chickenpox, I got it from somebody else, you got vaccinated for the chickenpox virus, I think it's chickenpox. They denied that process 4 times. On the 4th time, the child came in to see me, and I said, well, it's probably chickenpox, I don't know. My family friends, and so that child played with my children. My children came down with chickenpox. I called those pediatricians and I said, we've got chickenpox. That's chickenpox. They said, no, it's not. That child's 13-month-old sister came down with chickenpox. And at that point, I took the extra step of going to the lab, doing the swipe, getting the little things done, sending it into the lab. We had confirmed chickenpox. At that point, what I would say is that when you're vaccinating for an illness, what happens is we stop having people report that illness. Oh, look, it's great, we've solved this problem. I'm like, but there's children out there for whom the vaccine is not working. those people are susceptible, and now they're more vulnerable because the individuals who should be calling that in, reporting those diseases, are not reporting those diseases because they don't recognize them, because it couldn't possibly be that anymore. So I see this over and over again where I'm trying to diagnose something, I'm asking people questions, and they're saying, well, it could have been that, but we got vaccinated for it. So my answer is we need to have a whole step back about the vaccine debate, realize that when you start vaccinating for all these different diseases, you're going to have a greater proportion of those diseases kind of slip through the cracks because you're vaccinating for 5 diseases at a time. Some of those kids are going to get good immune responses, some of them aren't. But we're going to stop looking for those diseases once we've got the vaccines done. And it really doesn't help the families. Another reality is that when we vaccinate, say for Haemophilus influenza, what I see is that we had a few cases of Haemophilus influenza regular strain, and I think this is 3 or 4 years ago. Massachusetts had 1,000 cases of wild strain. So that was basically the mutation of the disease, so that the vaccine no longer is effective at preventing that disease. And that's again something that people don't talk about. Oh, let's just vaccinate, And I'm like, maybe the people who are actually paying attention enough that they're questioning the vaccination enough to actually not want to get their child all of those vaccines are not the people who are the enemy of public health. What's the enemy of public health is the people who are going along and doing exactly what they're supposed to do and ignoring any outcomes or any problems within that framework. That's my answer to the vaccine debate in a moment. Nutshell there.